Senator Durbin.
Thank you, Mr. Chairman. Thanks to the witnesses. Why are we here? We're here because Senator McConnell announced that this was a red line issue. This issue of liability in the age of COVID-19 is a red line issue, which he said was critical if he was going to support the next COVID bill, COVID 4. And Senator McConnell went on to say in another separate interview that when it came to the state and local governments, he thought bankruptcy was an option. Well, I can tell him that I don't think it's a very wise option for America, for the doctor, for the policemen, firefighters, paramedics, and others to face dramatic cutbacks in those who are working and cutbacks in pay for those who are working. This morning, when he was on the floor of the United States Senate, he addressed this particular issue, frivolous lawsuits in the age of COVID-19. He characterized them as an epidemic of frivolous lawsuits, a legal liability minefield, and then he went on to call them a tidal wave of lawsuits. I looked up the numbers as Senator Tillis did, and let me tell you about Senator McConnell's tidal wave of lawsuits that bring us into this hearing. So far, there have been 958 COVID-related cases filed this year. 27 of those cases were personal injury lawsuits, 9 medical malpractice lawsuits. The others, 264, were over the conditions in prisons, 171 were insurance battles as to what the policy really means. But when you consider that we've had 1.3 million Americans diagnosed with COVID-19, the fact that only 9 lawsuits have been filed, whether they're frivolous or serious, does not suggest a tidal wave of lawsuits. Instead, I think we get back to the point made by the chairman. How can we address this in a responsible way? 9 medical malpractice lawsuits, 1.3 million infections. The numbers that ought to stop us cold are the numbers Mr. Perrone gave us. Mr. Perrone, I have a bias toward you, as you know. My very first union membership was in one of your unions, working in a packing house, a meat processing plant in East St. Louis, Illinois. And when you tell me that 162 of your members working in grocery stores, food processing, meat processing, 162 of your members have died and 25,000 have been infected, those are numbers which stop me cold. I know what that was like when I worked there in college, 12 months in that packing house. It's a hot, dirty, dangerous job on a good day, and it hasn't changed much over the years. These workers, elbow to elbow, facing a conveyor belt with meat or poultry coming at them as fast as humanly possible. It's just not a good place to deal with social distancing. That's for darn sure. I would like to go to Mr. Smart for a minute and say, I took the time this morning, because we had a little more time on our hands, to read your testimony in full before we came together. I'm impressed. National Association of Convenience Stores that I've worked with in the past picked a great witness. The story you told about what you are doing in your businesses at this point is impressive. You obviously give a damn about the people who work for you and the customers that come through your doors. Just a list of things that you've done. But here's what you said at one point on page 7. This was a challenge because the guidance provided by CDC and OSHA, as well as state and local governments, often conflicted with one another, in addition to being vague and difficult to follow. Despite the many uncertainties, including the constantly fluctuating public health guidelines, we began to adjust to the pandemic. This is a point made by the chairman. We have got to have reasonable standards that make sense in the age of COVID-19, so that when you decide whether to put up those hand sanitizers or plastic shields and such, there's some guidance behind it. That is not just your effort in good faith to deal with it. It's your defense when somebody said you did nothing, Mr. Smart. You did, and you complied with the guidelines, and that's where we've got to go with this, Mr. Chairman. I don't think that's where your leader started off thinking we would be. So let me ask this question, if I might, of the witnesses here. Mr. Smart, if we can come up with some guidelines and standards that are science-based, would that help you in making decisions of what to do in your business so that you can say to the world, we've done what we were supposed to do?
Senator. Yes, that's a great question, and I would say yes. And maybe my understanding of this is off a little. I guess when I hear the conversation about specific guidelines from OSHA or CDC, whoever that body would be, I guess I look at past what we've been in, what we followed, what we could be liable for from not having proper guidelines, and what's going on. I mean, still right today, there's still no guidelines. Today, we're still operating businesses today, so we're still liable today. And then how long does it take us to get those guidelines? And that's why I guess for me, when we're asking for temporary, we're thinking temporary through this very unique situation.
I wish this hearing was entitled, "Why Has Our Government Failed to Produce Science-Based Standards of Worker Safety and Healthy Business Environments in This Age of COVID-19?" That's the question. I think we can give you these guidelines, and if you show a reasonable effort to comply with them, my friend, I believe you have a defense to most lawsuits that might come your way. And for Mr. Perrone, same thing true for you. When it comes to testing these workers before they go into the workplace, taking their temperature, perhaps giving them the COVID-19 test, and then a workplace environment that is established by certain standards is safer for your employees, isn't that the goal that you're searching for as well?
Absolutely, Senator. That's the goal that we're searching for.
Well,
Uniformity.
I would just close by saying, Mr. Chairman, I don't believe we have a bill before us, despite all the conversation, which is a shame. We should. And I would caution, as the professor from my old law school said, he wasn't my professor, but he teaches at a place where I went to school. As he said, this definition of gross negligence gets very tricky. Everybody has said we're not trying to protect bad actors. Bad actors get off the hook under gross negligence. It's the worst actors. Only they will be liable under a standard of gross negligence. So if we can work together on a bipartisan basis, I think there's room for improvement here.
Yeah, I think